current state of healthcare costs are unsustainable. It's a significant pain point for employers who have been forced to shoulder this financial burden and have had no choice but to shift more of the cost onto employees. Over the past 10 years, employer contributions have increased 62%, and employee contributions have increased 105%. Not only that, but out-of-pocket spending for employees for things like deductibles and copays have increased 69%. As patient healthcare financial responsibility continues to increase, salaries and wages are not keeping up, making the situation even more dire. In 2022, data published by Statista Research Department found that the median household income in the U.S. was $67,521. The average cost of healthcare for an American family of 4 on an employer-sponsored health plan, $30,260. That is 45% of their annual income. Since its inception, health insurance was intended to protect people from catastrophic medical costs. Yet, ironically, the number one cause of bankruptcy in the U.S. is medical bills. And what may surprise you even more, 2/3 of those who have filed bankruptcy due to medical bills had health insurance. So, despite the astronomical financial outpouring to insurance carriers, people are really not being protected at all. So, what's the problem? Are people more sick than they were a decade ago? No. People aren't going to the doctor more than they have in the past. If anything, they're going less. What has changed is price. Simply put, we have a pricing problem in healthcare. Different medical providers charge different rates for the same services, even within the same communities. And what makes it worse? No one knows about it. Providers tell us not to worry because it's covered by insurance, and insurance carriers tell us not to worry about the cost because they've negotiated a substantial discount with our provider. But how are we supposed to control healthcare costs if providers and insurance carriers won't give us a straight answer on the price of healthcare? In a traditional health insurance plan, insurance carriers contract with certain hospitals, specialists, and other care providers to create their preferred provider organization, also known as a PPO network. Enrolled members are directed to in-network providers with the understanding that this is their lowest cost option for them. But PPO networks are designed for hospitals and insurance companies, not the physicians and patients. By design, it's nearly impossible for patients to learn their costs for procedures in advance. One procedure will result in the patient receiving multiple bills, leading to confusion. True or false? Insurance companies are incentivized to control healthcare costs. False. Many think that insurance carriers are incentivized to keep costs down, but this is false. You're probably thinking, how can this be? Well, one provision in our current healthcare law focuses on a term called medical loss ratio. While it may have been drafted with the goal of managing costs, in practice, it is a significant driver of rising healthcare prices. The provision mandates that 80 to 85% of the premium paid to insurance carriers has to be used to pay medical claims. That only leaves 15 to 20% for administrative costs, marketing, and margin. This is what it looks like to the insurance company that tries to reduce total claims costs. As publicly traded insurance companies beholden to stockholders, do you see why it's counterproductive for insurance companies to lower claims costs? What's better for them? 20% profit of $100 million or 20% profit of $50 million? You guessed it, they're opting for the higher costs, and neither the insurance carriers nor their stockholders are sad about it. This is stock growth of the 5 major carriers over a 10-year period. True or false? Hospital systems are incentivized to control healthcare costs. False. Insurance carriers and their PPO networks are able to control a patient's access to providers. Providers are pressured to join PPO networks or risk losing patients and therefore losing revenue. Providers set their pricing, and the PPO network discounts the pricing for its plans. Because a provider needs to make a profit and the PPO network discount would cut into that profit, the provider will raise their prices, meaning they're not incentivized to control healthcare costs. The provider will raise the price of their care because they can't risk losing access to the network, and they get more money from increased pricing. Both sides walk away happy at the expense of the patient. The healthcare system that we all see as broken is actually working exactly as designed, just not for the employers who foot the bill, the doctors who provide the care, and the patients who receive the care. The good news is that there is another way. This downward spiral does not need to continue, and some employers have finally decided to do something different. When patients become educated about the true cost of healthcare and its impact on health insurance, then the healthcare crisis can be solved. We are dedicated to educating employees on being informed consumers of healthcare. Together, we'll explore the topics, tools, and other resources to access high-quality, affordable healthcare.